Here we are going to discuss about the rotator cuff muscles. So, what is the significance of rotator cuff muscles? Rotator cuff muscles basically are stabilizers of the glenohumeral joint. Glenohumeral joint, as we know, is a very mobile joint, one of the most mobile joints in our body. And as the mobility of a joint increases, the stability decreases. That is how it works. So, the glenohumeral joint basically sacrifices its stability to increase its mobility. But nature has provided us a way to stabilize the glenohumeral joint, and that is accomplished by these muscles. And these are the rotator cuff muscles. So there are basically four rotator cuff muscles, namely supraspinatus, infraspinatus, teres minor, and the subscapularis. So here, this is the posterior view. That is, we are looking from behind, and this is the anterior view of the shoulder. So as you can see, this is the supraspinatus muscle that is originating above the spinous process of the scapula. So this is the supraspinatus process, supraspinatus muscle, and it is inserted in the greater tubercle. This, remember, is the greater tuberosity of the humerus, uh, at the most topmost point of the attachment. Just below the attachment of supraspinatus, we have the infraspinatus, which is originating below the spinous process of the scapula, as you can see here, and it is also getting inserted on the greater tuberosity of the humerus. And then we have the teres minor muscle, which is actually originating from the lateral border of the scapula and originating just below the origin of infraspinatus. Now, we must remember a few points regarding supraspinatus. Is that supraspinatus is the initiator of abduction of the shoulder. 0 to 15-degree abduction is done by supraspinatus, and 15-degree to 90-degree is done by deltoid muscle, which we have discussed previously. And infraspinatus, as you can just simply imagine, regarding the infraspinatus is like infraspinatus, as you can see, if this muscle contracts, actually it can cause the lateral rotation of the shoulder joint, right? And as we have discussed in Erb's palsy, that infraspinatus is also paralyzed, which causes the arm to be medially rotated, as we can remember. And teres minor is also a lateral rotator. The teres minor is supplied by the axillary nerve. The supraspinatus and the infraspinatus, as you can remember, is supplied by the subscapular nerve. Subscapular nerve is a branch directly from the upper trunk, right? That is the only nerve which is arising from the upper trunk, along with the nerve to subclavius sometimes also arises from the upper trunk. So we have discussed these three muscles, that is supraspinatus, infraspinatus, as teres minor, which are inserted on the greater tubercle. The only rotator cuff muscle which is being inserted in the lesser tubercle is the subscapularis. Now remember, this is the anterior view, and this is a very frequently asked question in MCQ, which is the only muscle which is getting inserted in the lesser tuberosity of the humerus, and the answer is subscapularis, right? So subscapularis muscle is innervated by the upper and lower subscapular nerve. If you can remember, the upper and lower subscapular nerve are actually the branches of the posterior cord, right? So upper and lower subscapular nerve are the branches of posterior cord. So we have finally got to see that this, remember, this is the supraspinatus. Now one thing I want to mention is that calcified deposits and fibrocartilages are present in this tendon, and this supraspinatus muscle is the most frequently ruptured muscle of rotator cuff, and it is also called the neglected tendon of rotator cuff. Tendon pathologies are very painful, and this is usually neglected. This is also a very commonly asked MCQ, like which is the most commonly neglected muscle, and usually people answer subscapularis, since it is located inferiorly, but the answer is supraspinatus. So a quick review: supraspinatus, infraspinatus, teres minor are the muscle that are inserted on the greater tuberosity, and subscapularis is the muscle which is inserted on the lesser tuberosity. Supraspinatus and infraspinatus are supplied by the subscapular nerve, which is a nerve from the upper trunk. Teres minor is innervated by the axillary nerve, whereas the subscapularis muscle is innervated by the upper and lower subscapularis nerve. That is all about rotator cuff muscles.